And specifically, there are different types of mammograms. We heard in the intro a digital mammography, but what do you tell your patients that have an implant? Where do they need to go and what do they need to ask for a proper mammogram with the breast implant?
Okay. There are different techniques that are utilized, and there are also other screening tests besides mammogram. Women with dense breasts, whether or not they have an implant, may need an ultrasound as well, and that's a very useful tool for women with dense breasts to begin with. But there is a specialized procedure which is called an Eklund view. There was a physician back in the 90s who developed a procedure. It's also called a pushback view. And what they basically do is they're going to want to push the implant backwards and sandwich the breast tissue in front of it. And it gives a very accurate view. One of the things women have to understand who do have implants, however, is that they may spend a little bit longer at the radiologist's office, and they may occasionally require an additional view. So that is a compromise that they may have to take, in that it may take them a little bit longer, but they should feel very comfortable that they're getting a thorough examination.
And certainly, sounds like this is a very individualized decision, so you're providing this information to a question like that. A patient has concerns about it, but again, it comes down to ultimately to that patient's individual choice of whether or not to go ahead with an implant.
It really comes down to risks versus benefits. You know, there's a big psychological, emotional benefit from breast implants. Breast augmentation, we know, increases a woman's sense of femininity. We have a lot of data on that. So it really comes down to what risks they're willing to take, but they should be minimal if a patient continues to get thorough screening, just as they would if they didn't have breast implants.
That's a great answer. Caroline, let's take a look at the next question from the roundtable.
I've heard that they are not a one-time thing, that there's maintenance and that you just don't stop with the initial implant, that there's a maintenance, I think, and maybe you have to change them.
So how long do implants last?
Well, you have to remember that the implants that we have today are not the same devices that our mothers and aunts had. The implants have really evolved over time. Implants are very safe and effective now, the saline and the gel implants, and they do last quite a bit longer. But they are a mechanical device, just like a heart valve or a hip joint. They do have to be replaced at some point. You will outlive your implant. So basically, we recommend to patients that they are followed and they pay attention to the feel and the shape of their own breasts, and that there's certain criteria where they know that they need to come back in and have them evaluated periodically. But implants do last a long time, and they really should last upwards of 10 years. We're figuring that they have about a 1% per year deflation rate or rupture rate. So we basically get a good long time out of those implants.
Yeah, I think that's really an important point, because I know 10 years ago people said, well, at 10 years, most of those implants were ruptured, but just, you mentioned it, those are totally different devices than what we're talking about now.
Right, different shells and different fillers.
So what you mentioned, 1% per year, so basically at 10 years, there's a 10% chance that the implant would be ruptured, and
90% chance, exactly.
Which resonates,
right,
I think, very favorably with patients based on the current data. So she asked a question about maintenance several times, and what is maintenance? So if you have, I often say to patients, it's like owning a car. You buy a car, you got to change the oil every once in a while.
Well, it's not like a 50,000-mile checkup,
right?
Okay, so they don't have to have them serviced. But it does mean that a patient should follow up with her annual GYN appointment, her annual screening mammography, her breast self-exam, and most importantly, I think, is following up with a board-certified plastic surgeon. Somebody who knows what to look for and what tests to schedule as the implant ages. The woman's going to age, her implants are going to age, and at some point it'll have to be replaced, but she should not fall out of the loop. She should stay close to a plastic surgeon in her community, where hopefully the doctor who put her implants in, and then follow up and know when her next scheduled follow-up appointment is, and just to watch and make sure that it hasn't changed and her body hasn't changed over time.
What about after a pregnancy? If a woman has an implant and then undergoes a pregnancy, what can she expect afterwards?
Well, if you stay in practice long enough, you're going to see a lot of your patients end up having a pregnancy along the way, sometimes planned, sometimes not planned. But I usually try to follow my patients during their pregnancy. I like to see them once during the pregnancy to make sure everything's going all right. Usually towards the end of the pregnancy, when the milk starts to come in a little bit, they can have a little bit of secretions. That's when I'm a little bit more concerned, because there is a possibility of a mastitis. That's an infection of or a clogged milk duct. And what I don't want to have happen in a patient is that they develop some redness, some swelling, even when the milk comes in and they start to breastfeed, or they have some difficulty breastfeeding, that nobody pays attention to them. There is a possibility, there is a foreign device in their body, and we want to make sure we don't get bacteria. And bacteria can seed, what we call seed or spread to an implant, and cause a real problem. So somewhere along their pregnancy, I like to bring the patients back in and just go over these things. Just make sure they understand that they should be a little bit more aware than other mothers. They can certainly go ahead and breastfeed if they choose to, but just be aware if they do get a clogged duct or some redness to give me a call. They might need to go on some antibiotics. We usually just make sure that's something safe with the pediatrician and the OB/GYN. That's just something a little bit more to be concerned about, because we don't want to have any problems with the implant over the long term.
Any chance that a woman with breast implant that breastfeeds, the milk can hurt the baby?
That absolutely, we have excellent data to show that there is no transgenerational effect of silicone. It's a large molecule. It really can't pass from the breast tissue into the milk. And the funny thing is, they did some analysis of this back when we were doing those FDA hearings to see if implants are safe to go back on the market. And what we found is that the babies actually were absorbing more silicone-type products from the Mylicon and from the pacifiers and the nipples on the bottles than they could ever possibly get from a silicone gel implant.
So how about the aging of the breast over time? Does the implant delay the process of aging, or does that continue on as normal?
Well, you don't stop aging. I mean, I wish that, if you could just, keep a bra on and keep that breast up there, but you don't stop aging. So in addition to seeing women through their pregnancies and then after their pregnancies, the breast implant may do very well and stay in a good position, but their breast tissue may age over or come down. It's not even a pregnancy that changes as much as also weight gains and weight losses. That's really the big change. The breasts get larger during a pregnancy, you make a little extra skin. It never will look quite as perky and perfect as it did before that baby.
So after, say, somebody has a breast implant for 10 years, that does great, but over time they develop a little bit more skin laxity and they want to have a breast lift. Can you do that? Is that okay to do? Can you do a breast lift after having the breast augmentation?
Absolutely. I mean, patients will go on. It depends on, obviously, what their sense of perfection is, how far, or and number one, are they done having babies? Does it make sense to do it if you're going to have 2 or 3 more children? But sometimes patients will get divorced and then they're done having children or whatever. We see a lot of that. So it's really up to the patient's individual expectations. But a breast lift may come after pregnancies, but not all the time.
Well, I think that's incredibly salient information that you've given us today on breast health. Now, you came all the way from New Jersey, so we've got to kind of get our money's worth out of you today. But we'll have to. What we want to do is we take some questions from Twitter or emails to the Plastic Surgery Channel. So would you be willing to answer a couple of those
Sure.
after? Well, great.
Sure.
So we're going to take just a brief commercial break, and then we'll have you do that.
Did you know that breast implants can explode in an airplane?
Really? I didn't know that.
You know, you can donate the excess skin from your tummy tuck to the Shriners.
I can?
My doctor said Botox would get rid of your acne.
Oh, that's fantastic.
The Myth Files, dissecting truth from fiction in plastic surgery.